year's activities. As most of you know, the theme of this year's Black History Month celebration is Black health and wellness. So we thought that was right up our alley. That's what we do every day. And in light of some of the things we've seen over the last 2 or 3 years, this is very topical. So we decided to bring in an expert, Dr. Imani Walker, who is a psychiatric specialist. She just opened her own practice, and I was just told my camera is off, so even though that might be a good thing. So, okay, so now people can see me, so I apologize for that. So we have Imani, Dr. Imani, who's here to sort of lead this discussion, and with her background and expertise and certain personal experiences, we felt the perfect person to lead this discussion, and we thank her for joining us. I know how busy she is. She has a new book coming out shortly called The Calm Chaos. It's an emotionally raw, beautiful story about being raised in a family touched by mental illness. That book is due to be released in September. I hope I'm getting this right, Imani, September 20th. I've already pre-ordered my copy through Amazon, so I encourage you to do the same. Paula Madison, who we hope will be joining us shortly. She's a panelist. We're having a little difficulty getting on. I've known Paula and Imani both for over 30 years, and Paula is, with her lifetime experience and her professional background, I know that she can contribute mightily to this conversation, so we're hoping to get her on. She cannot stay because she's more busy than all of us put together, so she has another meeting at 9:30, so we're hoping to get her on. We also have Dave Holson. Dr. Holson is the director of our emergency department. He and his team of excellent caregivers, they stand at they're essentially the gateway of the hospital. They do a fantastic job, proved their worth like never before during the pandemic, and really kept this community safe and continue to do so. So we thank Dr. Holson for joining us. And we have also our nurse, Tiffany Johnson, who's an assistant director of nursing. She's part of our labor and delivery team and a perinatal expert. And again, that's an important topic. We're doing a lot in that area. So we wanted to have Tiffany be part of this conversation. So without further ado, I'm going to turn things over to Dr. Imani, and let's just get rolling.
Okay, great. Thank you, Cleon. It's good to see you, although virtually.
Can't hear you.
Oh.
Is she muted for some reason?
Can you hear me?
I hear you okay.
Yeah,
Okay.
we hear you okay.
Okay.
They can hear you.
Yeah.
Okay. Okay, great. Cleon, can you hear me? No, not yet. Can you hear me?
Yes, we can hear you.
Okay, perfect. Okay, so thank you, Cleon. It's good to see you virtually, which is pretty much how we've all been seeing each other these days. So I just want to thank everyone, all of our participants for showing up and basically being willing to discuss this issue that touches all of us. Obviously, since the pandemic has I wanted to say crept into our lives, but it basically just kind of bulldozed its way into our lives. We, as Black folks, usually have to deal with a multitude of things on a daily basis. And since this pandemic has been on the scene, we've had to deal with a number of things. One of the things that I will say that I've been really impressed by during this time is that with all of the events of 2020, including all of the just
Hi, Paul.
terrible issues that had to deal with police brutality or vigilantism on the part of people who we now know had white supremacist leanings or were just full white supremacists. I'm really happy to see that we collectively have really tried and are, I think, in various ways succeeding in putting our health and mental health first. So I just want to go ahead and start with that. But this discussion is pretty much, oh, hi to Paula Madison, who's my mom, um, who Cleon introduced a little while ago. So that being said, I would just like to open the discussion to, and I guess whoever wants to just kind of jump in, feel free. I just wanted to discuss initially, how has racism particularly impacted the Black community? We know that when it comes to Black folks, there definitely is, especially in medicine, we tend to get the shorter end of the stick for various reasons. There's definitely bias when it comes to just being, treated by um, medical professionals who don't look like us. But I think more importantly, what do any of the panelists believe? What should be done to address these health disparities in the Black community so that we can deal with this basically before we're confronted with the next health crisis?
All right, let me just kick off a bit. I think for me, firstly, before I even jump to disparity, what do we consider as health? All right, and World Health Organization says it's a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And so I want to use that as the backdrop in terms of any discussions we're having and helping us to understand why this is important to us as a community, our own health and wellness. We hear often a number of terms, the disparities, but what we have to understand, the system was built this way. And so now today, what I'm happy is that we're taking, to me, the first step. We're starting to have these difficult conversations because you need to have these difficult conversations. But we have to also agree that the system is set up this way. And if we looked even from when 2003, when Institute of Medicine published their book on unequal treatment, trying to confront racial and ethnic disparities in healthcare, it shows that people of color receive lower quality care. We have worse health outcomes than white people, even when we control for socioeconomic differences or health access and other things of that nature. So this is a deep systemic problem. And I think first you need to start having discussions. We have to figure out a way, and they've been doing a lot of this measuring, but I think we have to get beyond this now. Now we need increased awareness. We need advocacy. We need policies. And at the end of the day, we need accountability to address these disparities.
Hi, this is Tiffany. First of all, thank you guys for inviting me to the panel. I'm really honored to be here. But as far as the question that you raised, that's a question that we could talk about for days and days and days. There's so many different arms that touch why healthcare is such a topic for Black and brown communities. And one of the things I wrote down a couple of ideas when it came to your question, and there's so many different issues. We talked about access to care and outcomes. But another thing that I know that I've dealt with amongst my family and peers is perceptions of healthcare and the perception of the healthcare system. There are a lot of, our older generations who really don't have a lot of trust in our healthcare systems. And that's a barrier that we have to overcome. On top of that, access to care. Do you have proper coverage? Can you go to a facility or a provider that will accept your coverage? Are you self-pay? How much can you afford? That also affects our access to care. Our biases, and everyone has different biases that we deal with on a daily basis. And coming from, healthcare providers, nurses, family, whoever, we all have these biases that we have to address and we have to overcome in order to give quality care to all of the patients that present. But then when you ask the question, like, how can we combat this issue, the thing that popped up in my head first was education. People perish for a lack of knowledge. And so we have these perceptions, again, that could be alleviated by education and support. And I think that that's one of the first steps that we go to, addressing the issue, acknowledging the issue, and then educating.
I'd like to offer that there's an important aspect that I've learned over the years regarding advocating for oneself. I always have a Black physician as part of my medical team. And not having a Black physician as part of one's medical team can pose a variety of problems, but I'll give an example of how it impacted me. For some years, I was running marathons, and I had to stop because I thought I was having a pain in my hip that was created by running. I stopped for about 5 years, but in those 5 years, I was getting massages, MRIs, X-rays, visiting all kinds of doctors, including orthopedic specialists, and they couldn't find the reason for the pain. When I went to my endocrinologist, because I have type 2 diabetes, I explained this pain, and over a period of time, he kept changing my statins. I did not have high cholesterol, but the regimen for diabetes requires that you take statins. When I went to him, he kept changing them. In about the 5th year, I decided to take myself off statins. It was just a guess. Within a week of taking myself off statins, that pain that had been chronic completely disappeared. And when I went back to my endocrinologist, who happened to be Chinese descent from Vietnam, he said to me, "I don't understand why you're having this pain. I don't get it. This only happens in Asians to the extent to which you're explaining it." I said, "My grandfather was Chinese." Now, I bring this up in the context of, for African Americans, for Black people, for people from the African diaspora, there is going to be, just by virtue of living one's life and being in a family, more knowledge of ailments that afflict people of the African diaspora. What I hadn't realized, there were ones that were specific to Asians. So what I'm saying here is that the advocacy that one takes for oneself, including the education and the fact that people who look like us historically have not been included in trials. They don't test drugs, they don't test medications and applications for how to fix and repair. Historically, they don't test it on living Black people. They've been testing it on Black cadavers and people who really didn't give permission to be used. I could talk about Henrietta Lacks, but I won't.
There's something, I mean, to what you were speaking about, and also Tiffany, there's something that you had mentioned when it comes to educating. I do recall reading a study, I believe it was maybe 2 to 3 years ago, that when Black women who were depressed were offered services, and these were women who were let's say they were primarily in inner city areas, which is a term I hate, but that's just what the study had referenced. But when these women were given the option to get services, they overwhelmingly got those services. They overwhelmingly accepted those services, and then went on to actually have their depression treated well, and they ended up feeling obviously much better. What is something that, because granted, we do have a natural distrust, and we should have a natural distrust of medicine in general. I think about as far as the gynecologic the tools, and that when it comes to these tools that are, and a lot of them even that are currently being used in the present day, were modeled after tools that the quote unquote father of gynecology had developed, because he was actually experimenting on Black enslaved women. So what can we do to actually, I'm not saying let's sit here and all of us devise an education platform to be, you know, dispersed to Black folks around the country, but what do you think we can do collectively to get this information out there? Is it as simple as you know, enrolling Black doctors, of which there are only 4% of us amongst all doctors in the nation? Is it as simple as saying, hey guys, we need for you guys to basically get the information out there? Like, listen, we're Black doctors, medicine, yes, we have a right to not trust it, but it's not scary, and it actually is something that can be helpful. Like, what can we do to get our community healthy? And health can include mental health, physical health. So I'm just trying to figure out what can we do? How can we get this information out there?
You're gonna go Tiffany, or?
I'll go real quick.
Okay.
You brought up a lot of great points. It's funny. I've also moonlighted working in nursing schools, and I always made a point to educate these students, whether Black, white, Latino, Asian, whatever, on history of healthcare. They would be remiss to not know about Henrietta Lacks and everything that happened with her, about the Tuskegee experiment, about the gynecological experiment, about how informed consent came about, stuff like that. And so to be able to educate and relate this to real world experiences kind of brings it home. When it comes to our community, that mistrust is deep, right? And it's not just me like, you know what, hey, let me tell you about how you can improve your diet so you can, you know, lessen your A1C and so on and so forth. There comes a point where I've educated, but my comrades and my family sort of like, nah, I'm okay. I'm not going to go to that doctor. I asked them to take an educated risk, right? Take a leap of faith. I presented you with the data. And data, you know, most of the times is pretty concrete. But take a chance and see how it works for you. But take an educated chance. Do your research. What kind of provider do you want to go to? What kind of facility do you want to visit? Do the work beforehand so that when you go in, you feel like you're invested. You feel like you've researched this person. You're comfortable. You want to share all those deep, dark secrets that your provider needs to know so that they can take care of you. Because that's important. A lot of times we deal with, you know, uncomfortability with information about ourselves, you know, people's sexuality, their sexual practices, stuff like that, that they don't readily share that information. But I feel like if they got into a space where they're comfortable, that information would come out and we could, you know, take care of them appropriately. That's what I usually ask my family and friends, like, hey, just try it. If it doesn't work out, you know, let's go back to the drawing board and figure out how we can get you into that clinic or whatever. And I found that it's helpful. And just following up, And of course, working on the healthcare side, the inpatient side, as well as the insurance side, they're like, man, this is a lot of work. I got to do this appointment. I got to go. I got to do labs. I got to get the meds. So I got to follow up. It is a process, but healthcare is a process, and it's a lifestyle that you have to work on regularly. So that's my little 2 cents.
I want to add, what I would like to add is, for me, the distrust is a lot more than just distrust with the healthcare system. It's a distrust with the system on a whole. And most of us didn't grow up knowing about Tuskegee experiment and all these different, even going through medical school. But when you grow up and see that, even though it's kind of like we're equal but separate. It's that same phenomenon that keeps continuing. And so if we feel that declaration is made, I have a right to vote, but when I decide to go to get the chance to vote, then it almost would cost me my life. So there's a constant repetition. Recently we have, gun rights. White male can walk down the road, loaded weapon, and the cops walk straight past him. Young man had a licensed firearm in his own place, no knock warrant, wasn't even a person, gun dropped out, he's dead. So we have these built-in systems where you're telling me I'm equal, I have the same rights, but I'm not experiencing it. And so I think this creates this general distrust with everything. I think one of the things that is clear, Black folks are more comfortable with physicians and providers that look like them. And that is one of the things that need to be addressed in terms of how do we prepare to have more people of color in medical schools, becoming physicians, becoming nurses, becoming the ones who are taking care of their community.
I just like to add that I have been a full-fledged, when I say full-fledged doctor, I mean done with my training since 2009. And while I was a baby doctor, and now that I am, and since me being a quote unquote real doctor, I still, even when I see patients in my own practice, and I have an exclusively virtual practice, I have this entire time met patients when I would be in the hospital and walking around with a lab coat. It would say my name, it would say my credentials. I'd walk in, I would obviously introduce myself, and I would start asking a patient all of these questions. And if I could count, if I had $1 for every time a Black patient was like, okay, so when's my real doctor coming? And I was like, well, first of all, I just want to explain to you that please do not allow anyone in here in this room to come in and just asking you questions, and then you answer them and you're not sure if they're your real doctor. Obviously, I introduced myself, but but I understand, because it's still such a shock. Like, what is this Black person doing in here with some sort of authority asking me these questions? And now, like, are you actually, so you're gonna like treat me? And and on the flip side, there have also been, and I would say this was more so within an older population, there were certain patients that were like, yeah, no, I don't want to see you, because they, for whatever reason, obviously internalized racism. They were like, I feel more comfortable with a white doctor, and especially a white male doctor. And if that's the case, I was like, well, I'm sorry, like, you're stuck with me. but that being said, it still is like, oh, like you're actually going to be my doctor. There are a lot of reasons why it is just better that Black folks see Black medical providers, because there are certain things that are obviously unique to us, but also when it comes to just how we express ourselves, like what we, you know, what just think, like I can say, oh, did you hit this person up? And we all know what that means. Right. And I mean, there are little things that really can have a very big lasting effect. I actually have a couple of private practice patients, and when I first saw them, I mean, just really just at the end of their rope, crying. I'm in the house. Oh my God, made a little small adjustment to their medication, something minuscule. The next time I see them, like, oh, I took a trip, or oh, I just came from getting my hair done. Like it really, I guess I'm just explaining all this because we as Black healthcare professionals really do have a very great impact on our patients, especially when they are not only Black patients, but patients of color. I just want to say really quickly that Paula Madison had to lead the discussion, but we're obviously going to continue. I wanted to just talk a little bit about lifestyle changes, and that obviously can include diet, exercise, any type of like I don't want to say like I'm kind of hesitant to say self-care, because for some people self-care can mean like, oh, like I'm going to take a bath. And then and that's not, so some people are like, oh, self-care, like I'm depressed, I'm just going to take a bath. And that's really not something that is a is something that has led to have a proven outcome when it comes to depression, for example. But what can we do, especially when it comes to patients that, you know, may not necessarily have access to the best food, or even just grocery stores in their neighborhood? What, like, I guess what I'm asking is, how do we advocate for better lifestyle changes amongst our patients? Just because, I mean, because when it comes to me, I prefer preventative care. I don't, obviously, I do not like surprises. I don't want to wait all the way until like, oh my God, we've gotten to this point and now we have to do all of these procedures and make all of these changes. But how do we, I guess, get our patients, or just get our community to really take lifestyle changes more seriously?
That's a hard one.
I know.
I
I'm
know.
like, I'm realizing when I ask that, I'm like, that's such a general. Such
No,
a,
I feel
but
like you gotta meet people where they are.
yeah.
Not everyone has the same access or socioeconomic level to go to Whole Foods and spend their whole check and get
whole
vegan
paycheck.
drinks. I know, right? And do all this stuff. You know, some people might have maybe $100 for the month. And so you have to be able to be like, okay, with that $100, let's see how we can stretch that, but in a healthy way. Make food choices to where you can be fed, but also a semblance of health, because, you know, that's also an issue when it comes to diet. And that's a historic generational thing that we've had to adapt our diet according to where we were and your access. So I think it's not just a visit to the hospital approach, but it's a more long-term approach to where, say they come into the hospital for X issue. Then, you know, you really want to be like, hey, let's really talk about your diet or your lifestyle. You know, I can't even tell you how many times I've been to a physician like, oh, you need to lose weight. Oh, your bell curve this, and we already know about that, you know. And so I have to realize that not everyone has the same access and education as me, and be able to help them create a plan. Find the necessary resources that they can use for follow-up. Be like, hey, it's been a month, I'm calling to check on you. Maybe a support group, different types of issues, not issues, but resources of that matter. It's a long-term battle, but I think that if we were to provide comprehensive healthcare. Like we use these patient medical homes, right? They're supposed to be able to give us the services that you need right then and there, but then also long-term, if you need social work resources, housing, stuff like that. So if you have a home that, check in with you, check up on you as a person. And I know I've encountered providers that do call and check up on you, but like, hey, how are you doing? I think that goes a long way, not only to help a person adhere to their plan of care, but also that follow-up and care element actually helps to decrease that mistrust as well. I feel like this person is really invested in me and cares about me. So you know what? I'm going to go the extra mile to try to do better with my eating. I'm going to make sure that I go out and walk for 30 minutes 3 times a week, stuff like that. And so there's a more efficient way to do it. But of course, that comes with, more hands on it, probably more jobs, and of course there's a little bit of a higher cost. But at the end of the day, what is it? An ounce of prevention is worth a pound of care, right? So it can be done if you have people who are really supportive and really attached to that. And my idealist mind is like, yes, we can do it. Let's go out there. Let's give good health care. But, the reality sinks in. You have to be like, okay, how much is it going to cost? How many people are we going to need? And then you have to find the healthy balance therein. I always used to say, I feel like healthcare is not just, quality care, but there's a cost to it. And so we have to find the happy area where you fall kind of in between, where you give quality care, but not super, 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 super expensive. That's just, some thoughts.
It was a simple question, but it's actually quite complex when you think it through. Because diet and lifestyle, I think, is how we choose to present the information. Because if I just hear diet and lifestyle, I think of it in terms of something when everything else in my life is taken care of. And then when I have extra, then I could start thinking about these fancy stuff of diet and lifestyle. And I think we have to transform that into saying that this is actually part of our basic existence. And, the recent changes they're making even in the school diets in New York City public schools. I think things like this is key because when you go to a lot of our neighborhoods, it's much quicker and cheaper to get junk food than it is to get fruits and vegetables. And that's the bottom line. These are the neighborhoods where you see 40-ounce things of alcohol very cheap, and so we have to start looking at access to healthy food to start with. All right. And 2, start that I think every touch point, whether through school system, an encounter in a clinic, what have you, we have to take advantage of all of these touch points in terms of educating the community, in terms of tying their health with their diet and activity. Whenever somebody comes into the emergency room and I notice their blood pressure is elevated, might not be ready yet for medication, but I start having that discussion with them. What's your diet like? What's your exercise, doing? And even for me with my activities, as much as possible, I use the stairs instead of taking an elevator. Those are simple things people can do step-by-step, gradual basis in terms of changing their lifestyle.
There's 2 things, excuse me. There's 2 things that you mentioned, Dr. Holson. And the first thing that you mentioned is that it was a very important point you made, that when it comes to lifestyle, meaning exercise and diet, a lot of us, not just Black folks, think of it as, well, when everything else is taken care of, then I can address this, instead of looking at it as, well, you got to eat every day.
Yeah.
And you do need to move around every day. So this isn't something that that should only be relegated to, well, when everything's great and I have all my bills paid and I'm feeling better, then I can eat a salad. I mean, that's a gross oversimplification, but I think it's really important for all of us to really digest that, because it's something that even I will say this: doctors are not just doctors, but medical professionals are not always the healthiest people.
That's true. That's true.
And so even for us, it's, well, I know the human body. So I'm fine. So if things get really, really bad, then like I'll take care of it then, but I'm just busy and whatever. And it's not so difficult to therefore understand why our community tends to do the same thing, in terms of like, well, I don't have all this time. I have to deal, like, things come at all of us on a daily basis. So when I get to that point in my life where I am, I feel great, then I will address this. I think, and so the second thing that you had mentioned, which now slips my mind, and if it's important, I'll come back to it. This is what it was. The second thing that you mentioned also is something that when my mother, Paula Madison, was on, she didn't speak about this, but my mother had told me that she was working for GE, for a GE company, and she got physicals every year as part, because she was an executive, and her doctors didn't tell her that her blood sugar was creeping up year after year. And it wasn't until it hit that threshold and it was like, oh, well, now you have diabetes. Instead of what you were mentioning, Tiffany, like, oh, well, you know what, this is something that looks kind of concerning. It's not an emergency yet, but let's keep tabs on it, and maybe let's have you make some changes so that it doesn't get to this level. And that is something that, I mean, I can't sit here and point to a particular study, but when it comes to bias, I definitely feel that this is where it is key to have Black folks be seen by Black medical professionals, because we can identify with that. I'm just
it's funny because I remember, I'll share a personal story to where I always thought, I always want to support, my Black, brown, and female providers, or anyone who gives good quality care. It's something that's really important to me. I do my research beforehand, all that stuff, right? But then one time, I was going in because I was having a lot of dizzy spells, I was working out, I was eating pretty well, but I still had developed high blood pressure, the genetic side that I can't control, right? So one day I told my provider, I was like, hey, my grandmother died of a heart attack. And so I was like, I would really like to do a cardiology consult just to make sure that everything's okay, She was like, oh, you don't need that, you can wait till later. You're young, you don't need that, right? I kid you not. A month later, I was at work. I started having a lot of palpitations, chest pain, and I thought, oh, I'm just nervous because I had to do a big presentation, and I tried to do my relaxation, all that stuff. It wasn't working, and then it developed into more distinct chest pain. So I said, oh, no. I took myself down to the cardiology department, and I was diagnosed with a first-degree heart block, and I was like, this is what people experience when we tell someone, hey, I really like this for my care, but then your idea is totally shot down. But then if they'd just taken a second to slap an EKG on me, they probably would have seen that I had that first-degree heart block. And so I share that with people because I'm like, even though here I am as, a healthcare professional, educated, a Black female who does advocate not only for her patients but herself, and it still happens to me. And I think about taking care of other family members, and I tell them, ask them this, do this, do this, do this. Write it down on a piece of paper if you need to, so that they can be empowered. But even though you put forth all that effort, sometimes it still happens, but the key is, if you see it happen, say, skirt, let's stop. I'm not getting what I need, and then escalate it. And, we always joke about it, talk about, the nurse curse, all this stuff. Like anything that'll happen will happen to the nurse when she goes in for care, right? But it's a true thing that we have to be cognizant of and think about that when we're taking care of our patients. And, for everyone listening and whatnot, as a healthcare professional, when you're out there treating your patient, whether they're black, white, female, brown, think about what they're saying and listen to what they're not saying as well. And be like, I wonder, let me just, put an EKG on there. Oh, let's draw this lab. And so, and help to combat that bias. I know we've been dealing with a lot of bias training because it's a big hot topic now, and rightfully so, especially when it comes to the area where I predominantly work, which is in maternal health, and dealing with bias. And, there's a variety of different programs we're part of. We do a lot of training, a lot of data and stuff. But the key here is just to, not only acknowledge it, but also try to combat it and use these real life experiences to kind of bring it home so that people can understand it. Because people are like, oh yeah, I did that diversity training last week, whatever, But make it relatable, make it realistic. And I think that could help us a lot too.
Something that I have taken note of during this whole discussion has been advocacy in terms of advocating for ourselves, even if, and especially like what you were speaking to in terms of, oh, well, I feel like I should maybe get an EKG, like, oh, you're fine, it's fine, don't worry about it. That's one of the things that I definitely tell my patients, like, listen, like I will listen to you. And if you tell me that you really do want something or you want me to check out something, I definitely will. And speaking of advocacy, we obviously need a lot of help when it comes to instituting programs and just, being when it comes to racism, and the systemic racism that this country thrives on. It definitely, advocacy of ourselves and advocacy of our communities is something that we need in order to be recognized. So I'm just going to preface this by saying that this is a very general question, but what do you all think we can do as far as getting better advocacy so that we can get better programs in place, or just programs in place that can benefit our communities? Does it need to come from more community-based grassroots level, or is it something that you guys feel is this something that you guys feel that can be addressed at a higher level, like a state level, a federal level?
I think this is such a complex issue, and it has been for such a long time. It has to be attacked from multiple angles. All right. I'd mentioned earlier, we have to look at medical school recruitment and education. All right. Two, you do need policies, you do need laws. How we set up a system, what do we get reimbursed for? Because even as I was listening to Tiffany speaking, sometimes the doctor might not be hearing you because they know they have 20 minutes for a new visit, or whatever the time frame is. And that's the challenge. And so I think this has to be looked at from multiple angles, because there will be no one simple solution, but built into whatever we're doing, we must have policies that support it. We must have accountability, build quality into dealing with some of these healthcare disparities, not just saying, okay, I want to improve X, but what are you doing to improve X among your non-white population? And I think that's one of the form. But one of the key things for me as a community, we have to understand our value because it comes back to value. Who am I as an individual? You know, I've always said medicine is, you know, I always say it's a calling because when you think about it, a complete stranger come off the street, tells you the most intimate details of their life, and a lot of times expose the most intimate parts of it. And that to me is such a deep trust. And so we need to get to that place where everyone, when I think all Americans should look like all of us right now on the panel. All right. Because we have these concepts that get built in that this is what ideal looks like. And it usually doesn't include a face that looks like this. And we have to get that human thread connected in everything that we do, that yes, this elderly Black female is just as important as that white executive from the Upper East Side. We have to start getting that across because this is why medicine needs to be that level playing field.
I'm also of the mindset that not just from higher up, and what he said is totally correct, but you have to support the community and the grassroots as well. Take a multi-pronged approach because, both, you kind of close in on your enemy, right? I would routinely, when I was training new nurses and nursing students, a lot of them felt uncomfortable speaking up. What if I rock the boat? What if I say something wrong or whatever? I'd be like, just practice what you're going to say so that you get your point across and that you can advocate for your patient. I can't tell you how many times I say, one of your main roles is to advocate for your patient. Be the patient's voice when they can't speak. Because a lot of times they revere healthcare providers, doctors, nurses, NPs, PAs, leadership. And they'll listen carte blanche to every single thing that they say, right, and follow it to the T without saying a word. But they might in the back of their head be thinking, I don't want to do that. But somehow be able to empower them. Just speak up and say something. Even start off small if you're not comfortable. And then paired with the leadership approach, the policies, the mind change at the educational level with providers and nursing, it will make such a huge difference. And it's about pre-wiring, and then so that people think different when it comes to taking care of these patients, because the biases don't instantly come overnight. They're ingrained in people's psyches over years and years and years, norm. And so it's hard to undo those biases, but maybe if we start off, not only, educate as best as we can, but start off with the new minds that we have and say, you know what, take that extra time to listen to this patient who looks different from you, who might need different testing and resources than you. Put yourself in their shoes. I know it sounds, old school and cliche, but put yourself in their shoes and see where they're coming from so that you can appropriately care for them. And, I know we're pressed on time, but I would be remiss if I don't talk about how all of these issues we've talked about are directly related to our maternal mortality rates. That's where I work. That's what I know and love, right? I see it on a daily basis, and in, 15 years of nursing, I worked in Georgia, I worked in South Texas, I worked here in New York, and the different things that, I've seen when it comes to caring for patients, I was totally flabbergasted. I was a new nurse in Georgia. They asked me, "You're the nurse? What?" Like, yeah, I'm your nurse. I'm here to, deliver your baby, help deliver your baby, even to the point where, you would have patients who would come in with like HIV positive patients, and, they would treat them like they were lepers, like they were, And it just, it would just irk my soul. And I confronted a provider one time. I said, you know what, I'm not trying to be disrespectful, but the way you spoke to her was really inappropriate. And after that, I advocated for my patient, and it kind of created a camaraderie between me and the provider. I'd be like, you know what, Tiffany's really advocating for her patients, take this seriously. Maybe I can look at the way that I'm talking to the patient. But again, if we just take the time to listen to the reports of our patients, women dying from childbirth, it should be a normal, happy event. But people are passing away, whether during birth or afterwards. They're coming in with PEs, preeclampsia, all kinds of stuff. And if we had just taken the time to listen to what they said and what they weren't saying and how they presented, and then also check your biases, like, no, she's not stronger because she's a Black woman. She legit has headaches and steam floaters. Maybe she has high blood pressure. Maybe, what are we doing so that we can address these maternal mortality rates? Because we have all of this technology and money and education, but our women are still dying. What can we do?
Economics. That's my solution. It has to be tied to economics. I believe in education, but you're not going to get behavior change until it costs something. All right? And it comes back to my thing about value. Maternal mortality in this country is the worst among the developed world. All right?
Agreed.
A Black mother is 3 times more likely to die compared to her white counterpart. All right? And so we have to start tying these statistics to things that are meaningful so that change can come about.
I just want to, first of all, thank you. Thank you so much for that last point, because when it comes, I truly believe that when it comes to advocating for our patients, I do think that Black doctors, Black medical professionals, because of the biases and the discrimination and just the systemic racism that we have to deal with on a daily basis, I have always contended that we are able to put ourselves in other people's shoes better, especially because even when it comes to white patients.
Yeah.
Because we just know what it feels like to not be heard. And so that being said, I want to say thank you so much. Thank you so much for both of our panelists. I just want to say that I think this has been an awesome discussion. It definitely warrants just further discussion, more follow-up. So thank you so much, Dr. Holson. Thank you so much, Tiffany Johnson. I want to hand it over to Stephen Monroe, who is the labor chair, and just so he can help, I guess, take everything home. Oh, you're muted.
Yeah. No. Can't hear.
Oops.
We had tech problems in the beginning and
I
tech
know.
problems at the end.
I know. I'm just trying to
If
stay
nothing
quiet.
else, we're consistent. So while Steve does that, I just want to say a big thank you to the panelists. Imani, you are a star. I thank you so much. I think it was a great discussion. Like you said, these are starting points. There's so much to be done, and it's a shame that we can't do these kinds of things more regularly and find a way to involve the patients and members of the community. I know some of the things that we've done. We're starting a plant-based menu on the inpatient side. So it's an institution that's mission driven. and that is that understands some of these unique, well, they're not so unique, some of the issues that the Black community has to deal with. Looking at diet, we just got a grant that our pediatrics lead is doing, where the doctors will get training in terms of nutrition. I was startled to learn that most doctors through medical school really don't get much in the way of education when it comes to nutrition. And I've always wondered, how can you take care of people if nutrition is not a part of it? And that's why
That was a requirement of my BSN program.
right,
So not when I was in med school. Like no nutrition.
so so as an institution, I think we get it, and it's easy to look at public hospitals, but we deal with these issues every day more so than other institutions. So, and we have people who look like our patients and people who speak their language, and all of that makes a difference. And we believe our patients are getting better care because of that. And we're committed to listening to our patients, doing the plant-based diet, and I think, Steve, are you up? So I bogarted and took a lot of talking points, but I just want to say thank you, Imani. Thank you to Tiffany and Dr. Holson. You guys were awesome.
So I just want to jump in right here and once again say thank you to everyone. On behalf of the Joint Labor Management Committee and our CEO, Mr. Neil Moore, I would like to thank all of you for participating in this year our Black Virtual History Month Committee. The discussion was very fruitful. We heard about disparity to health and in our Black committee, distrust among the Black diaspora. We heard about advocacy and one need to advocate for oneself and the community. We heard about respect. And so folks, so we had a very good panel put together. So once again, as Cleon mentioned, we just wanted to thank Dr. Imani for coming on and doing such a wonderful job. Our next panelist, Paula Madison, who had to leave early. Our very own Dr. Dave Holson, for taking us down such a remarkable lane as he explained what took place in our committee, and our very own Tiffany Johnson, who was very, very good and articulate as she explained to us some of the barriers to health care and some of the issues that we have in our community. Folks, once again, our panelists were awesome. And we just want to take this opportunity to thank you. Cleon mentioned earlier about our plant-based initiative that we're rolling out here. And this is all part of our hospital and in extension, Health and Hospital trying to, looking forward to promoting healthy living. And so we have Dr. Stein Albert, who is one of our leader in this initiative. So as we continue in this regard, I just want to say happy Black History Month as we reflect, we have come a long way, but I will say we have so far more to go. So once again, thank you all. And I wanted to thank our committee members who have come together to put forward this program today. And on behalf of all of the staff at QHC, we wanted to thank everyone. Thank you all once more. Thank you very much.
Thank you.
Thank you. It was a pleasure being here. Thanks.
Bye.
And with that, we're signing off, and we just want to thank all of the attendees who took the time to join us. We wish we had more time. We wish we could have taken questions, but an hour is really not sufficient to do this, but we're all busy people. Our patients are our priority. And as far as the plant-based initiatives, our health system, just to put it in perspective, we're the first in the nation to be doing this. So we're going to lead the way. We're going to be the trendsetters. We're going to be the living example that these issues are not insurmountable. We have enough talent, and if anything, this panel has proven. I mean, listen. I mean, a nurse like Tiffany Johnson, with the credentials behind her name, which is like 10 of them, it's like awe-inspiring. So I just want people to know that that's the level of talent that we have right here at a public hospital. We care about our people. We're mission-driven. And I thank all of you for being part of that. Let's get the good word out and let's do our part. It's about self-empowerment. It's about stepping up and like Dr. Holson said and Imani said, sort of reprioritizing what's important. It shouldn't be an afterthought, but it should be a strategy in how we live. So thank you very much. Thank you for joining us. All the best.
Thank you.
I'll talk
Thank
to you.
you.